Hi, I'm Corey Warner, and I will be presenting on the topic of autism. This is a disorder that's very close to both myself and my family. Um, we're very passionate about it because my younger brother Adam was diagnosed on the autistic spectrum when he was very young. So please forgive me for all the Adam spam throughout this presentation. So, what is autism? Autism is also known as autism spectrum disorder. A lot of times people think that autism is one specific disorder, but it's actually a very broad spectrum of disorders that all fall under the same umbrella. One of the main attributes of autism as a whole is the inability to communicate and interact socially. This is often present from early childhood, which is unfortunate because oftentimes autistic individuals will have difficulty forming relationships with other people. There's no known cause for autism, and it's generally accepted that it's caused by an abnormality in brain structure or function. So, some signs and symptoms of autism. There's many different levels of awareness that autism affects. Behaviorally, things such as inappropriate social interactions, poor eye contact, or persistent repetitions. Developmentally, autistic individuals will usually learn at a slower rate compared to a normal child. Cognitively, usually autistic individuals will obsess over a handful of different interests. For example, my brother Adam is obsessed with monster trucks, WWE, and construction equipment. And one of our close family friends who was diagnosed with Asperger's, his name was John David. He was absolutely obsessed with cartoons and comic books. He could tell you any random fact you would want to know from any comic book. So, how common is autism? Autism affects 1 in every 68 Americans, as seen on the autistic spectrum. This is a tenfold increase in the past 40 years, and more than 200,000 reported cases in the U.S. right now. And also, interestingly enough, autism is 4 times more likely to affect boys than it is girls. Okay, as far as treatments go, it can't be cured, unfortunately, but treatment can help. Medications include risperidone and Seroquel, and there's a bunch of other common therapies, including anger management, family therapy, applied behavioral analysis, behavior therapy, sensory processing, and animal-assisted therapy. So, some benefits of exercise for autistic individuals. These are some of the benefits that exercise has for autistic individuals, other than the obvious ones that are beneficial for the general population. These things include improved balance and voluntary motor movement, decrease the occurrence of interrupted stereotypic behavior, improve social competence, attain agility and confidence in sports activities, activate behavioral neurons in the brain, and can also relieve other comorbidities such as anxiety, depression, sleeping and eating disturbances, attention issues, temper tantrums, and aggression or also self-injury. So here was a case study that was done which outlines one specific physiological benefit of how exercise can directly reduce some symptoms of autism. Autistic individuals often have self-stimulatory behavior that they repeatedly do, such as a twitch or a tic that acts as a way to receive sensory feedback. Unfortunately, these behaviors distract children from response cues from the environment and or interrupt previously learned behaviors and also learning. This study aimed to disrupt the feedback loop by using exercise instead of the non-functional behaviors. The individuals were monitored and did a mild exercise plan as well as a vigorous one. It was found that the stereotypic behaviors decreased by 7.5%, but after 90 minutes they returned to normal. These decreases showed that exercise could replace the stereotypic behavior when it is at a sufficient intensity. Okay, so a couple talking points about autism and exercise. One thing to keep in mind when exercising with autistic individuals is that along with behavioral effects of autism, autistic children often have vestibular system dysfunction, which may affect their balance. So you don't want to have them doing activities on high balance beams where they might fall off or something like that. If the individual doesn't like water, don't make them swim. Individuals with autism enjoy doing the things that they enjoy doing, and there's probably not going to be a whole lot changing that. Movement is the best therapy for autistic children. And also, if the child didn't approve of the activity that they were doing, it probably wouldn't be very beneficial because they're probably not going to be putting a whole lot of energy into it. So don't just throw an autistic person on a treadmill or on some sort of machine in the gym and expect them to want to keep doing it, because it's probably just not going to happen. Okay, so I really like this quote about autism and exercise. I just think it's really important to remember that individuals with autism, especially children, are still individuals. Even though they're able to do they're able to do anything that their typical counterparts can do. It just has to be taught in an adapted fashion, and it just has to be beneficial for the individual. Okay, so for my client case study, I decided to do it on my younger brother Adam, who does have autism. I freaking love this kid. I think anyone is truly blessed to come in contact with him. He's taught us so many things about the simplicity of life, and just makes our household a much livelier place to live in for sure. Although Adam was diagnosed with autism, he's also been diagnosed with a few other disorders which make it difficult to place him in one exact category on the autistic spectrum. Along with autism, Adam has also been diagnosed with Mobius syndrome, which is an extremely rare neurological disorder of the brain categorized by the weakness or paralysis of the 6th and 7th cranial nerve. So that means he is nonverbal, and often individuals with Mobius syndrome do have a very distinct facial formation. Adam also has severe ADHD, asthma, and a seizure disorder, which is most likely related to the autism. Due to all of these disorders, it's a little difficult to place Adam in one specific place on the spectrum, like I said before, but what I can tell you is you have to see this kid hit a golf ball. He's 20 years old, 5'6", 115 pounds, so he's getting pretty big. He's not really my little brother anymore. He's extremely active. I mean, this kid's outside for hours on end, just hitting golf balls, just shooting hoops and stuff. No risk factors, so that puts him at a low risk for exercise, and his goals are to maintain a healthy lifestyle. So for the exercise tests that I chose the 1 mile run-walk test. I chose it because it's very simple, it's very short, it's the individual doing it isn't going to get distracted very easily, which happens very often with autistic individuals. And that was for cardiorespiratory endurance. And for my muscular endurance test, I chose a 1-minute squat test. Once again, it's very simple, no equipment required, and it's a short duration, so the individual isn't going to kind of just get distracted and go off doing their own thing. For my exercise prescription for autistic individuals, I have frequency as 3 to 5 times per week, intensity, moderate intensity, 40 to 60% of their max heart rate, time at least 60 minutes, type, autistic individuals usually I would stick with various sports and physical activity, swimming, walking, backyard gym activities, kickball, soccer, golf. Swimming's great. It allows for a greater range of motion and fluidity and ease of movements. I would just recommend to do things that individuals enjoy doing rather than forcing them to do something that they don't want to do. If they don't want to do it, you're not going to make them. Fun balancing activities to improve balance are also great with autistic individuals. Here I have a video of Coach Dave working with an autistic individual. You can watch this on your own just so you get an idea of what an exercise program might look like. So, in conclusion, what is autism? Autism is a group of complex disorders involving brain development. There's no cure, but it is treatable with therapy. It's important to incorporate activities into their daily lives that make exercise fun and enjoyable for the individual. Sometimes the greatest achievements are just getting to do things that a quote-unquote normal person gets to do on a daily basis. As far as Adam, he has overcome so many boundaries. He's 20 years old, graduating from high school in the spring. He participates in a program at ESU, East Stroudsburg University, called SILS, which stands for Career Independent Living and Learning Studies, and it's a program that's designed to provide individuals with disabilities a way of learning how to live independently in the real world. And he'll also be attending ESU in the fall, and he'll be taking classes there. And he actually just got his own apartment, so we're all really excited for him. For more information on autism, I would encourage you to visit this website, autismspeaks.org. I really like this quote. I think it really speaks to Adam. It really does narrate every aspect of his life, and this is absolutely incredible. You gotta watch this. Okay, thank you very much for taking the time to listen to my presentation.